Thank you very much, and thank you to Public Health England for inviting me and the opportunity to set out how we're trying to approach child obesity prevention in the boroughs that hosted the Olympic and Paralympic Games. And just in case you don't know, we are Barking and Dagenham, Greenwich, Hackney, Newham, Tower Hamlets and Waltham Forest. My role is to facilitate all 6 local authorities, NHS partners and stakeholders, including the GLA, London Legacy Development Corporation and indeed Public Health England, to work together to secure a positive health legacy for East Londoners from the investment in the Games. And part of this legacy is that the boroughs that hosted the Games are now actually driving London's economic growth, and so that's why we now refer to ourselves as growth boroughs rather than the host boroughs. But in light of our challenges around child and adult obesity, it's probably quite apt. So the Olympics were a once-in-a-lifetime opportunity to speed up the transformation of East London. It wasn't the start of it. There's actually a lot of things going on before then, but it's acted as a catalyst. But despite the vitality, the vibrancy of the area, people living in the growth boroughs die younger, earn less, have fewer qualifications, are more likely to be unemployed, live in overcrowded accommodation, or to be a victim of crime than for the average Londoner. And that's what when we talk about the convergence gap, that's what we're referring to. It's that gap in outcomes. And the ambition of the growth boroughs is to eradicate this gap in outcomes over the next 20 years. The growth boroughs hold 18% of London's population, but 62% of the areas of highest deprivation. So we're not saying that other parts of London aren't as deprived. What characterises the growth boroughs is the concentration and the extent of deprivation, and that's been a real pull to help people to work together. You're all very familiar with the Jubilee line graph, so I'm going to show you a different one, but it makes the same point. It sums up why securing a legacy from the Games is so important. There's an 8-year gap in male life expectancy between West London, the western end of the Central Line, and the east at Leighton, and the gap for women is 7 years. So that's our context. Earlier this year, not much earlier this year really, back in September, the chief executives of the 6 growth boroughs agreed that addressing child obesity will be their strategic priority for health convergence. It's not the only thing we measure around health, but it would be the kind of core of our focus. And our ambition is that children maintain a healthy weight as they grow and develop, and our objective is to deliver a sustained downward trend in the level of excess weight in the growth boroughs' children by 2020. The chief executives agreed that they'd facilitate joint actions so that the growth boroughs are a place where active lives are promoted and supported, eating and drinking healthily is the easier choice, and that healthy organisations develop. This work is collectively led by the directors of public health in the 6 boroughs, and as I say, supported by other agencies, including a growing number of academic institutions as well. Who's been to Stratford Westfield? Oh God, there's not that many East Londoners here. Or you're just not admitting to it? Okay, thank you. Our emerging approach is based on the work of the London Health Improvement Board to develop a framework for tackling obesity in London. And at the core of this work is recognising that we live in an obesogenic environment. That word really winds some people up. Some people really like it, so I kind of try to use it carefully, but I think in terms of this audience, you do understand what that means. And when we refer to obesogenic environment, for me, I mean, Stratford Westfield is just such a symbol of that. You get the bus or you drive there and you park. Once you get inside, there are no stairs. There are narrow escalators, which even if you wanted to walk up them, you can't because they're too narrow, or they're lifts. It's total sensory assault, and every few yards, there's an opportunity to eat or drink. And if you go on to level 1, Mr. Pretzels will be there handing out the free samples of the pretzels. But also, actually, our high streets are not much better. They've become dominated by cars. They're not, many of them not designed for pedestrians and cyclists, and also what characterises many of them, particularly in more deprived areas, is the proliferation of fast food takeaways and betting shops. So what's the consequences then of the obesogenic environment? Well, it's obesity. And as a nation, and as people have pointed out, as a nation, we've all grown bigger over the last 40 years. And obese children tend to become obese adults, which is why we're focusing on child obesity as a start. The slide shows the figures for London and also the convergence gap between the growth boroughs and London for overweight and obese at reception and at year 6. And all 6 growth boroughs feature in the top 10 local authority areas for child obesity. Now, that's not something to beat ourselves up about, not even something to be ashamed about. I mean, quite frankly, it's a product of the other things we've talked about. It's a call to action, and that's how we need to take it. So obesity is the outcome of this obesogenic environment, and that's why we need to tackle the causes of obesity in terms of sedentary behaviour, physical inactivity, poor diets, easy access to high sugar, high fat, high calorie food and drink, and addressing the environment and the culture that shapes and constrains our behaviour at an individual and a population level. And recognising that there is often less chance and less choice to make the healthier choices in deprived communities. Now, local authorities, as Councillor McShane pointed out, have a significant leverage in terms of altering some of the environmental factors that contribute to obesity, such as unsafe walking and cycling routes, and the proliferation of fast food takeaways. And local authorities have a range of legal, licensing, statutory and civic leadership powers and responsibilities that actually can improve access to healthy foods, can improve the quality of parks and open spaces and the provision of sports and leisure facilities. And we really mustn't underestimate that leverage that local authorities have to change the environment and the culture. So we're not saying don't do anything, just look at the sort of the big issue stuff. And everything that we are going to do together will build on some of the best practice that's going on across the boroughs. So I just want to highlight some of the interventions that are taking place, in particular some of the ones that start very early in the life cycle, and also some which reflect a whole systems approach. So, launched last year in Newham, New Baby, New You, is a very early intervention. So it supports new mums achieve a healthy weight, and it increases their understanding of healthy eating for their babies and their children. And the service is offered through the children's centres across the borough, so some of which also have community midwifery services, which means it's very accessible to the mums. You're going to get these slides, so I'm not going to run through all the details of them. And where I've got a web address for them, that's on the slides. Tower Hamlets NHS and the Early Years Service collaborated to establish an approach similar to the Healthy Schools model for the early years setting, because they identified that was a gap, and it was really kind of important gap because it was an opportunity to intervene early. So I think, correct me if the figures are wrong, but I think around 30 early years settings, including all the council's children's centres and several schools, have achieved accreditation. And there are positive outcomes in terms of physical activity levels, healthy eating, emotional well-being, oral health, and parental engagement, which has been very important. And we're waiting to hear if we've got a research grant to actually evaluate specifically the impact on physical activity levels from that accreditation scheme. But I hoped I'd know by now, but I haven't. I hope that's not bad news. Councillor McShane has referred to Health Heroes in Hackney, so I won't go over that. What's important is a whole school approach. And when we talk about the whole school, we're not just talking about the teachers and students, we're talking about the parents and carers, and also particularly the community assets around the school. The evaluation will be published very shortly. I've been told I can say the new year, and I think what's good is some of those early positive results that Councillor McShane referred to. So, in particular, one of the things that happened early on was shifting the timetable around, which meant that no class missed PE because of bad weather. It was a classic example. Two classes scheduled to have PE, one hall to do it in, one group to do it outside, and if the weather was bad, that meant that class didn't get it. It sounds so simple, but actually it's a change that's been made which everybody's benefited from. And another really positive intervention has been setting up a weekly fruit and veg stall linked to the local food co-op, which is in the process of the parents taking over running and being responsible for that. The NHS and Greenwich Council have worked together over a number of years, I think, to invest significantly, particularly from the PCT side, in physical activity promotion and services. So Greenwich Get Active is part of their physical activity care pathway, and it includes a specific focus on families being active together. And I think it's a really good example of a large-scale intervention that can actually is designed to reach the whole of the population. And for so much of what we do, actually we can't say that. But there's an example there of something that does. Love Mums has used social marketing techniques to identify the barriers to breastfeeding in Barking and Dagenham, and it's also running in Waltham Forest. And so through the local authority and the NHS, there's support provided to mums, and the scheme also works with businesses to create baby feeding friendly areas. And one of the things I particularly liked about it when I came across it is producing leaflets and information for dads, but also to grandparents, because that's again one of the insights that came out of the social marketing, that often there was potentially a great source of support, but actually grandparents weren't supporting in the way that they could. And Waltham Forest go Dutch. So Waltham Forest, along with a number of other local authorities in London, is trying to increase cycling to European levels through improvements to the cycling environment and making it safer and more pleasant. The council's removing some of the barriers to people taking up cycling, such as safety, convenience, and access to bikes and safe storage. And again, this is a really good example of a whole systems approach, because it's not about one or two officers in cycling doing something, it's about the whole council and how it makes its investments. And likewise in East London, I could wax lyrical about cycling in Hackney, but that's for another day. And here's actually a pan-London kind of intervention. All your boroughs have engaged with it. So Capital Growth supports community food growing across London, but it's an approach I would say that has been particularly embraced in East London, because to date we've actually delivered 25% of the new community food growing sites, and if you remember, that's based on 18% of the population. So it's a league table that we're proud to be at the top of, and I have to particularly reference Tower Hamlets, Greenwich and Hackney in terms of the number of sites that they've developed. And it's a win-win, isn't it? It helps people get more active, it connects people with their local communities, and it can actually play a really important role in improving access to affordable fresh fruit and vegetables and supporting healthy eating. So, in a sense, that was the easy bit, because that's some of the really good things that we're doing. But I think we have to be honest and say, actually, that's not enough. That's not going to deliver the kind of scale of change that we need. So, based on learning from the London Health Improvement Board's work to develop a framework for tackling obesity in London, and also the evidence internationally, including New York, which has been referred to, but also actually a number of European towns and cities. I think there's some key features necessary to make progress. So, strong political leadership is a prerequisite to change. So it's really important and really great to hear that it's members like Councillor McShane actually providing that. We also need to deliver together interventions that address the wide range of the causal factors and are also pitched at lots of different levels in the system, both at a kind of very local level but also at a kind of strategic, borough-wide and actually sub-regional level. I think strong community engagement is essential, and essential in the planning and delivery of interventions, using social networks and community assets to change attitudes and norms, and with a consistency of branding and message in any engagement. And I will talk a little bit about cycling in Hackney, because that's one of the things coming into the borough. I live nearby, but actually working there is actually cycling to work is like normal. And actually, yes, some of the blokes do wear lycra and high-vis jackets, but do you know what? A lot of the people I see parking their bikes in the morning, they're just like me, and they're dressed like me, and it's kind of not a big thing. But the council has taken a whole lot of steps with its own workforce to support that, but also a lot of wider steps around that. And I think it's really important that there does need to be a culture of robust evaluation and ongoing review, and a commitment to review and actually adapt in light of the learning. There's not some nice, simple kind of linear path that you go, and if you do this, actually you know what the result is. It's much more complex than that. We saw the spaghetti diagram earlier. But what we do need to hold on to is that actually success is possible. So in the USA, amongst preschool-aged children from low-income families, obesity has decreased in 18 of those states. In New York, there's been an absolute decline in population prevalence of obesity over the 5 years, from 21.9% to 20.7%, and an increase in life expectancy of 1.5 years over the same period. New York has had the Bloomberg administration, and that was prepared politically, I think, to take on vested interests such as the fast food chains and make initially very unpopular decisions, including limiting the size of sugary drinks for sale. And there's colleagues from Public Health England who, I think this very week, are in New York to actually understand more and then find, I think, hopefully effective ways of disseminating the learning from that. And I think a key feature of New York is that it's been a whole city approach. So every department in the city authority has had to identify what it can do and what it can do differently to tackle obesity and to improve health and well-being in New York. And I think it's a real model for us to follow. So just finally, what we know, of course, is there's no silver bullet in terms of tackling obesity. And probably what matters as much as what you do is actually how you do it. And it's also important, I think, that any joint activity we undertake in the Growth Boroughs actually builds on existing activity, on planned investments. It both comes out of what we're doing, but it can also inform and shift what we're doing. And listed there is the sort of long list of areas of focus over the next 2 years. So I'll talk a little bit about walking and increasing walking and cycling. We're getting to grips with actually how all the boroughs are planning to spend where they've been able to lever in new money from the GLA and the Mayor's cycling strategy, how they're planning to do that, but also encouraging them all to actually audit the plans and actions against the NICE guidance for promoting walking and cycling. Again, a local example that's happened in Hackney, and it's really interesting because it identifies 2 things. It identifies some gaps in practice which can be addressed, but again it also identified the issue of scale and how you might seek to scale up some of actually very good evidence-based approaches. Currently, we're refining the vision and the narrative, because I think, again, how we tell the story of what we're trying to do is really important, and it's really important that elected members and our executive leaders are part of shaping how we tell the story. That, again, it's not seen as something kind of old style, which is public health, the NHS, Department of Health, boom, this is what you're going to do. It is actually what we do grows from our understanding of kind of local needs as well as what works. So we're investing in engagement again at all levels of the system. We've had a number of discussions with academic partners. We're in a really great situation in East London because, particularly actually as a result of the Olympics, we've got a number of academic institutions moving into East London. Loughborough is an example of that. And so we're meeting them again in mid-December to start to scope out how you might evaluate this kind of approach. So not the individual interventions, but actually how you work at a kind of whole system, large-scale level. And we're also working with the GLA and London councils to clarify the statutory powers for boroughs to enable temporary road closures for play streets, because it's a slightly interesting area. Outside of London, there's a very clear power that exists. London, we do need to clarify it and not let that get in the way of doing the right thing. And finally, we're identifying some early wins that are visible and that our local elected members can point to and say, these are the kind of things that we're doing and these are the kind of things that are making a difference. And yes, actually, we really do want to change the world.